Okay, hello, welcome to Ask the Surgeon Week. I'm Dr. Castañeda from Cosmet. We're going to talk about breast augmentation frequent questions that actual patients have written to us. First question is, how do I know if I should have my implants placed over or under the muscle? Okay, this is an important question. Always the selection of plane for implant placement is important. Basically, there are three techniques. Subglandular technique, which is pretty much out of use. There's a submuscular technique, which I leave for patients that have little breast tissue on the chest area, so the implant is not so obvious, so we place it under the muscle there. And the most commonly used technique here is under the fascia. No, it's a subfascial placement. This gives us the advantage of the submuscular plane having a better contour on the profile of the implant, so it's not so noticeable. Plus, it's not so painful, the recovery, as the submuscular placing. So it is a very good type of surgery. Next question is, how long will it take me to recover from my breast augmentation surgery? The answer for this one is around 2 weeks, more or less, no? For regular, normal, everyday activities, like driving, lifting your hands overhead. If it was submuscular placement, probably around 3 weeks is a little bit more painful recovery. For more activity like exercising, weightlifting, cross-training, anything like that, it's going to take a little longer, between 4 to 6 weeks, depending on each case. No. Next question is, should I be concerned about the brand of implant my plastic surgeon uses? Definitely you should. This is a great question, and it's one question that you should always get an answer to. There are implants that are very reliable, have good warranties. We've been personally to some of the factories that manufacture these implants in Europe, in Southern America, so there are a lot of implants that are very good quality. So make sure you're getting one of those, no? Next question, how do I know if I need a breast lift? Well, through measuring, through a consultation with your surgeon, so you can come to an agreement on a cup size, on a type of look, on having not so much risk for complications if it's gonna be too tight. So the only way to know for sure is contacting us through the website. You can send us your photos, we can do a virtual consultation, you can come in for an in-person consultation, and we can come up with a personalized plan for you. What about cup size? Another important question. Well, also, the important thing is to come up on an agreement with you as a patient and your plastic surgeon. Now, sometimes what is desired is not possible or can carry unnecessary risks. So it's definitely a question you have to get an answer to during the consultation. How often do I need to replace my breast implants? The answer for this is between 15 and 20 years of implant placement. This is if, well, there haven't been any other symptoms or complications or anything out of the ordinary. So between 15 to 20 years is a good time to have a new pair of implants put in. Usually this second surgery is quite easy on the recovery aspect of it in comparison to the first one, because really the cavity is already made, so surgery is way less. Finally, we have what is the difference between silicone implants and saline implants? The difference is the content of the implant. Both shells are made out of the same type of silicone. The saline ones, well, you fill them during the surgical procedure with saline water. And on the case of the silicone filled ones, today's implants are cohesive gel, and it's a very soft gel, so texture also is quite improved on this type of devices. Well, I think that's it for today. Keep sending in your questions, and we'll have these segments on a regular basis so you guys have more information.